Dialogue with a Doctor, featuring Southwest Florida's leading physicians.
Hello and welcome to Dialogue with a Doctor. My name is Dr. Gregory Leach, and this is a show where we interview experts in the medical field about their craft. This is actually part 2 of a segment on Gerd, acid reflux basically. And we talked about proton pump inhibitors like Prilosec and the controversy related to those with Dr. Phillips had talked about this, and now what we want to talk to Dr. Phillips about is, well, what do we do now that we know we need to pull back on these drugs?
Right. Well, as we were just talking about a moment ago with gastroesophageal reflux disease, GERD, is that we've had an overwhelming success with this category of drugs, proton pump inhibitors. You know, again, to restate, Prilosec, Protonix, Prevacid, Acifex, and these drugs have been very, very successful, but you know, it's becoming increasingly clear with the reports of potential complications associated with dementia, the potential complication of kidney damage, issues about potentially exacerbating osteoporosis, that it really underscores, as we were saying earlier, that these drugs, we should use them for the shortest duration possible and the least amount possible. And that's what the principles that we learned in medical school in terms of the pharmacological application of any kind of medication. And it applies to this as well. And so when individuals come to me and they have had bad acid reflux and they have been using these medications for months and potentially years now, and they're concerned about this, you know, we have a discussion about what can be done to reduce how much of the medication they're doing and potentially try to find alternatives. And it's a worthwhile discussion, but it involves some understanding of the nature of the medication and understanding the physiology of the stomach and how it produces acid and other items. Just some interesting facts that are fun to consider. Acid is well, everybody produces acid within their stomach. It used to be believed that acid was something that went away as you grew older, but apparently it does not. Your capability of producing acid is maintained throughout your lifetime. Proton pump inhibitors are so effective in terms of preventing acid production that the stomach responds by increasing its capability of producing more acid. But that's blocked by the proton pump inhibitor, so that by the time an individual has been on this medication for a number of weeks, your capability of producing acid has been almost doubled or tripled. And so if a person abruptly stops the proton pump inhibitor, they'll get roaring heartburn like they'd never experienced before. They'll get a rebound hyperacidity and so it's important when individuals consider reducing or looking for an alternative, they be aware of this phenomena and reduce the medication appropriately. Now, the other things that can help in terms of reducing the medication or reducing proton pump inhibitor is looking at the timing of the medication. The timing of the medication is important because the nature of proton pump inhibitors, you had mentioned earlier that it's an antacid. And really, it is much more profound than that. Antacids neutralize acid. The proton pump inhibitor actually prevents acid from ever being produced. And in each little acid-producing cell in the stomach, there's multiple little factories for production of acid, and each little factory, a little molecule that pumps out acid, only lasts for 24 to 36 hours, and that's what the proton pump inhibitor inactivates. So, and the capability of producing acids really revved up before a meal. So if you take the proton pump inhibitor before a meal, it reduces acid production more effectively. So if you're taking a medication twice a day with meal, you can oftentimes get by with once a day if you take it about 30 to 60 minutes before a meal. It'll reduce acid production more completely. So the exposure to the medication can be much diminished if you just look at the timing of the medication.
So, I mean, for most people, it's a 24-hour drug. They're just taking one a day.
Yeah, most people. Some people, though, take it twice a day, and you can get it to. But even an individual who's taking it once a day, if they look at the timing of the medication, they could potentially take it every other day. Because if you look at that timing, you can get an effect up to 36 or 48 hours after the use of one dose. And in those waning 12 hours or so, sometimes something simple like a Gaviscon is a stopgap measure that can help reduce acidity and reduce symptoms associated with reflux. So those are two strategies. One, just to be aware that when you're trying to taper off a medication, you should do it, this particular medication, it should be done over a period of a couple of weeks to reduce it. And then when we reduce it further, it can, by looking at the timing in relation to a particular meal, if, for example, you're in the habit of taking it with breakfast, if you take it before breakfast, it'll work for a longer period of time. And potentially, we can get by with less medication.
Or can they be used in combination with the other medications, the Zantac, Tagamet, that block acid?
Well, and that's and the answer is yes. They work in different fashions, so they can be used together. And what we'll sometimes aim to do as a strategy is to reduce the proton pump inhibitor and get an individual off of it. And sometimes in that context, they'll still have acid reflux, but it can be controlled with a steady daily or twice daily dose of Pepcid or Zantac as an alternative. Those medications, much safer, really very few side effects associated with them, and they have a little more flexibility in terms of their use. So it's possible to transition from one medication to an alternative medication as a way of trying to minimize the total dosage of the proton pump inhibitor.
Will there be some patients that will be on both of those drugs at the same time? If you reduce the dose of the proton pump inhibitor, but you need the other to augment?
Yeah, and that's another strategy, is that at times you can anticipate when you might have more reflux. Here in Naples, you have people visit, they stay long, maybe they stay longer than you want. You go out, you go out more often than you like, and you go out to dinner several nights in a row on a weekend, and you know you're going to be staying up late and eating more. You know you're going to get more reflux. In that event, you can use these proton pump inhibitors in a strategic fashion. That is to say, use them for 3 days and then stop it, and then at other times revert back to the use of Pepcid or Zantac. So there's a strategic way of using it as well, trying to target times when you know you're going to have more difficulties, and then transitioning back to an alternative medication. Now, of course, you can live the monastic life and just eat, and that's another alternative. Where
be perfect, you mean?
Yes, it'd be perfect. We just eat bread and water and just go to a monastery. But even there are some individuals that have such intense reflux that option is not always successful in terms of leading to a resolution of. So not only do you get to eat a very restricted diet, but you still get to suffer nonetheless. And so that would be. That wouldn't be a desirable alternative for most.
I know there are specific foods that can promote acid reflux because the lower esophageal sphincter will relax and let acid backwash if you drink alcohol or chocolate, maybe. Well,
you're absolutely right. There are certain foods that lead to an event where that valve that separates the esophagus from the stomach, that's supposed to open to allow food and water to enter the stomach or liquids to enter the stomach, and then closes. In some circumstances, that valve will relax. Alcohol relaxes that valve. Certain medications will relax that valve. And I won't go through all the different medications, but there's ones that antihypertensives, such as calcium channel blockers, like Norvasc or amlodipine is one example. But these are medications and there are other ones that can cause relaxation. But certain foods will cause relaxation. Foods that taste really good, that have fat in them, will tend to lead to a circumstance where you can have more ready reflux. And that occurs because foods that taste good require a longer period of time for the stomach to empty out. And as there's a longer dwell time of food in the stomach, there can be an opportunity for it to reflux more readily. So that's the emphasis on eating a low-fat diet in that circumstance. Yeah, think back to the last Thanksgiving Day meal where you ate all those rich items with a bunch of fat in there with the mashed potatoes and gravy and so forth, and you felt full all day long. That was because the stomach, which is pretty smart, knows that you had a high-fat meal and stopped or slowed its emptying to such a degree that it slowly released its contents to the small bowel so the small bowel could extract every bit of calories you took in from the high-fat items, which take longer to digest.
Which you don't really want.
Yeah, so exactly, but your stomach doesn't, and your GI tract and your small intestine doesn't know when the next meal's coming. So it's been designed always to extract the maximum amount of nutrition from the food that you take in.
Survival.
Yeah, exactly. Yeah, for your GI tract didn't know when the next meal was coming, so it.
Have there been identified in food combining certain combinations of food? You were saying that, you know, something that tastes good, but if somebody eats some bread and it doesn't bother them, if they eat a tomato, it doesn't bother them. If they eat cheese, it doesn't bother them. But if you put those together on a pizza with oil, they're done.
Absolutely. There are certain trigger foods that have been identified that will really promote reflux for individuals. And you've hit that combination of tomatoes is one for some individuals. And it's not, and it's very, I have individuals that say, well, I'll just no longer eat acidic foods and that will make it go away. It's not that the foods are so acidic, because the stomach, the amount of acid your stomach produces, the pH is 1. The most acidic food, like vinegar, maybe 2.5, a pH of 2.5. The stomach is almost 100 times more acidic than the most acidic food that you can eat. So it's not the acid component. The reason why certain acidic foods are annoying is that if you have an irritation to your esophagus, it burns on the way down. Just like if you have a cut in your hand, you put lemon juice on there, it burns like fire. But once the cut heals, you can take a bath in lemon juice and it's not going to affect you. So there are certain trigger foods that will really, really promote reflux. And when you get a combination of events where you eat a rich meal with a high fat content, where you eat a large volume of it, because when you eat a large volume of food, it puts more pressure on your stomach and more pressure to reflux up into the esophagus. As I just said, when you eat a high-fat meal, it slows the emptying so that the so the volume of food in your stomach remains there for longer. Then when you combine that with alcohol, such as wine and so forth, it causes a direct relaxation of the lower esophageal sphincter. And then when you top that off with a little chocolate mint, and chocolate relaxes that valve, but the mint has a direct effect to relax that valve. So you're talking about a typical dinner in Naples where you eat a high-fat meal, where you have it with alcohol, where you have a chocolate dessert, you follow it with a mint, and you go home and you're sleepy and you lie down and no longer even have gravity to help hold things down in your stomach. And you go in a horizontal position and you reflux all night long.
Does refined carbohydrate, specifically refined grain, white flour products, does that increase the probability or combination with that of acid reflux?
Yeah, it does, to the extent that when you have any kind of caloric intake, it does stimulate acid production. And it immediately slows the emptying of the stomach. Whereas opposed if you took a balanced electrolyte solution, like in the Olympics are only going right now, and you see all these individuals drinking electrolyte solutions. Those empty out of the stomach in about 5 minutes. They're very fast emptying items. They have a little caloric content, but usually mainly it's electrolytes and water. And so those empty very, very rapidly. But anything with any more caloric content will really slow the emptying and promote that reflux. So individuals sometimes will even notice with conventional foods, like carbohydrates such as bread or or pasta, that they'll get issues in terms of reflux as well. So even with simple items, you can have reflux. So that's why I was saying those individuals who have bad reflux, even if they live the monastic life and live on bread and water, they can still have reflux and have troubles. So
we just don't eat calories.
Yeah, right.
We lose weight and we don't we don't have acid reflux.
Yeah, right, exactly.
So I don't know if that's going to happen.
No, it's not going to happen. So at any rate, I just the points I wanted to make is the approach to reflux. It's really a combined effort in terms of diet, looking at weight reduction, and being thoughtful about the medications, trying to minimize the dosage and duration of medications in particular, but the proton pump inhibitors really have a really important role. And for those individuals who have severe reflux disease, they need to really rely on those medications. But it's important to have this conversation with your physician so they can have really have an input and help guide a therapy, and not have individuals act out of fear, and instead act in a position of knowledge about the understanding the medications they're using.
Well, I think this is great. I think you've given patients a really good idea of how to deal with this situation, given the latest information that we should be using less of these. So thanks a lot.
Well, thanks so much, Greg. I
really
appreciate it. Yeah, I enjoyed it.
And you will be back again, I'm sure.
All right, thanks so much.
Thank you for being with us.